I'm Clay Johnston. I'm the Dean of the Dell Medical School at the University of Texas in Austin. One of the things that drew me to this job is just how problematic the healthcare system is and how it doesn't deal with its problems. That's what I'm going to talk about now. One example that may seem humorous, but actually I think is a really important one to think about is the hospital gown. No one likes hospital gowns. I mean, I myself have been dehumanized by having to wear one. Who wants to wear something that shows their bum whenever they're out of bed? It also encourages behavior of patients that we don't want, like keeping them in bed. Doesn't serve any useful function for nurses or docs. It's time to redesign them for all of us. So you got the flu, you're sick, you want to be in bed. To know that you have to get out of bed, as sick as you are, get in your car, drive down to the doctor's office, wait 40 minutes because the doctor's behind, go in, see the doctor for 10 minutes, be told, take some Tylenol. In the meantime, leave your germs all over the doctor's office and getting others sick in your wake. This problem could easily be addressed with email or a phone call. Our system doesn't allow that kind of care because a doc only gets paid when he or she sees you, and that's ridiculous. Perhaps of these examples, the most important is that no one currently pays for prevention. Nearly half of all Americans suffer from a chronic disease. It's nearly 120 million people, and the vast majority of those are preventable, and preventable through relatively easy, straightforward means. Prevention is the key to reducing burden of disease. We pay a whole lot more once someone has a disease, and once they have a disease, they're suffering. In order to get the healthcare system focused on prevention, we have to align the interests of the system in producing value. Practical solutions that maybe reduce the cost of healthcare, that embrace technologies that reduce the need for hospitals, the need for clinics. We've got a great opportunity to do that here at the University of Texas at Austin. Imagine that we can recreate our healthcare system so that it's really focused on producing health, keeping you as healthy as possible, using technologies, using physicians and other practitioners, working better in teams. If we're successful, maybe none of us has to wear one of those terrible hospital gowns.